Now, according to the U.S. Department of Health and Human Services, peripheral arterial disease affects an average of 8 to 12 million Americans. September brings awareness to this disease in 2 local medical venues. They're offering free seminars coming up in just a few weeks. Dr. Mitchell Waskin, good friend of the show, and Dr. Ashwani Kumar are here to tell us what the signs and symptoms are of PAD. Great to see you, gentlemen. Nice to see you. Happy
nice
Friday. Dr. Waskin, tell us what is PAD, and I can't believe that it affects so many Americans.
Well, PAD is one of those things that a lot of people have heard about, but they don't really understand how significant it is. Basically, it's a clogging of the arteries. It can happen anywhere in your body, but it's more in the lower extremity and the legs, and as it decreases blood flow, it can lead to gangrene and amputations. And what's significant about it also is that it doesn't just affect the leg. People that have peripheral arterial disease also are at a greatly increased risk of heart disease and stroke.
Doctor, what are some of the symptoms?
One of the very typical symptoms of PAD is people, they get pain in their legs when they do some sort of exertion, like walking or going upstairs. And most of the time, this pain will go away when they take rest. So this is a typical but not the most common symptom. Most commonly, like, it will present in the form of a fatigue, difficulty in walking or gait. So most of the people, because this is a disease which affects more of the elderly people, and they blame it on their age, so they do not seek the medical advice for these kind of symptoms.
If it's not addressed, doctor, over the long term, what could happen?
Over a period of time, as the disease progresses, it can lead to the pain while even patients are resting, and also because there's a blood supply is not enough to your leg, they're more prone to develop any infection. And infection can lead to the wounds, and they might not heal as quickly as they should because they do not have enough blood flow there. And also, if the blood flow is not restored, they can develop a condition called gangrene, and gangrene ultimately leads to the amputation.
It leads to amputation. That's pretty bad.
Yeah.
Doctor, what steps can people take to maybe lessen the pain or even prevent PAD?
Well, part of it that you can't prevent, because part of it is one of those things that keeps on giving from your parents, which is the genes. Which
so it's hereditary.
Part of it is, but then there are also other risk factors that you can control. So a healthier lifestyle is important in doing it. And if you do get some of the complications, or hopefully you're seen sooner than that, and you get some of the symptoms, again, one of the main ones is this tiredness in your calf muscles when you walk just a short distance. You want to seek help. A podiatrist or an interventional cardiologist are 2 specialists that work with a lot of these types of patients.
Doctor, you were saying it's prevalent in a lot of elderly people. Even at a late age, can people improve their cardiovascular health?
Sure. As Dr. Waskin said, there are certain risk factors. That's what we need to look at. So if you improve or prevent those risk factors from developing, like if you have a high blood pressure, control that. If you have high cholesterol, we need to control that. And if you smoke, smoking is actually one of the most important factors which leads to the PAD. So along with that, the other lifestyle changes which people can make at any age, doesn't matter how old you are. If you are physically active, you need to exercise on a regular basis. You need to keep your weight under control. So these are the additional lifestyle changes you can make, and that can prevent further progression or development of the PAD.
Doctor, we have a few seconds left, but tell us about the seminars that you have coming up.
We've got 2 seminars, one at the Foot and Ankle Center and one at the Harborside office, Virginia Cardiovascular Specialists. We're going to talk about peripheral arterial disease, what causes it, what you can do to help decrease the problems that it can cause, as well as what treatments are available. And also for all the people that come to the seminar, there'll be a free screening for poor circulation in the leg, as well as a free foot exam.
No matter the age, get out and exercise.
That's true.
Doctor, thank you very much. Dr.
Nice to see
Waskin,
you.
it's a pleasure. We've got some
Thank you
information
very
right here about those seminars that Dr. Waskin was talking about. The Foot and Ankle Center and Virginia Cardiovascular Specialists present seminars for peripheral arterial disease Tuesday, September 13th at the Foot and Ankle Center on Johnston-Willis Drive. And again, on Tuesday, September 20th at Virginia Cardiovascular Specialists on Harborside Center Loop. Both sessions are from 5:45 to 7. Now, the seminars are free, but registration is strongly suggested.